Huma, welcome to Let the Quran Speak.
Thank you for having me.
I'm so excited that you're here to talk about a very, important topic, anxiety, because increasingly we're finding that people are saying that they have anxiety. So, I guess the question is, well, what is anxiety? People have so many myths and misconceptions about it. The first misconception is that anxiety is not a real illness. So, can you address that? Is it a real illness, or are people just imagining it?
Well, I will say that anxiety is a completely normal emotion that we all feel and experience. And it has kind of an impact on the way we think, the way we feel, even just the physical sensations, or like a racing heart, sweaty palms. But when it gets to extremes is when it can become an illness. Mm-hmm. And it is completely real, particularly as the numbers show that it is. It's a problem in the world. Mm-hmm.
So let's say, how would you differentiate between regular anxiety that somebody has and then, generalized anxiety disorder, which is much more serious? At what point would it require medical attention?
Mm-hmm. So I think most of us can think of examples in our life where we have felt anxiety.
Yeah.
So
you have to write a test, or
exactly.
you're running to catch a train,
so let's say right before a final exam, you're worried about failing. Mm-hmm. You're maybe having some racing heart, some sweaty palms. That to me is completely normal and expected anxiety. However, when it crosses the line into now it means I can't actually focus at all during the exam, I now want to avoid writing all exams, I'm limiting going on campus because I'm worried about my marks and how people are perceiving me, that becomes a problem. Mm-hmm. So that line generally is when it starts impacting your functioning. Mm-hmm. Generalized anxiety disorder is a more extreme form of worry. So people with that tend to worry about everything. And it's more than just that. It's actually hard for them to control when they start worrying, and they have physical symptoms. So some physical symptoms can be muscle tension, irritability, restlessness, problems with sleep, problems with concentration. Mm-hmm. And the big important thing when it comes to any type of illness is that it has to impact your functioning. Mm-hmm. So those that have those symptoms, it gets to the point where it interferes with their ability to live the life that they want to live. And that's when you need to get help.
Mm-hmm. How common is generalized anxiety disorder?
It's one of the most common mental illnesses. Mm-hmm. And it's something that I think we can all kind of relate to and connect to, is that we often find ourselves worrying a lot, mm-hmm. right? But the difference is that those with generalized anxiety disorder, they often have a difficulty breaking those worries. Mm-hmm. So if you think of it as a car, we all accelerate. But when it comes to braking, people with generalized anxiety disorder can't really stop that worry, mm-hmm. and then it leads to problems in their functioning.
So some people say, you're anxious, just get over it.
Mm-hmm.
Just get over it, just do what you have to do, and you'll be okay.
Yeah.
How would you respond to that for someone with generalized anxiety disorder? I'm assuming they can't do that.
No. Telling someone with anxiety, just get over it, it really is minimizing what they're struggling with. I can tell you that I've seen hundreds, probably thousands of individuals with anxiety, and it wreaks havoc in their life. They can't sit still and just be at peace. Mm-hmm. So to tell them just kind of get over it, they would love to get over it, mm-hmm. right? So it's something they can't just pick up and do and make a decision on that.
Mm-hmm. Or someone says, if you had the willpower, you could do it,
Where to me, I think it is, that'd be nice. But it is something that there is a definite cycle when it comes to anxiety, where people with anxiety often have negative thoughts about the situation or whatever is triggering their anxiety. So I can't do this, this makes me nervous. Then that leads to a lot of physical sensations, so heart rate increase, maybe problems breathing, and that often leads to changes in behavior. So they might then avoid the activity that's leading to them feeling anxious, which then brings about some temporary relief. So they feel a little bit better. Mm-hmm. But what ends up happening is that cycle loops. Mm-hmm. It continues to occur over and over again, often getting people to have live more and more in a bubble. Mm-hmm. And it's hard to break out of that cycle. People with anxiety usually have been suffering with this for years. Mm-hmm. And to say, you should just have the willpower to do it, I don't think that's fair.
Mm-hmm. Do you think, let's say, a person with anxiety should avoid stressful or difficult situations, in which they feel anxious?
I would say that's almost impossible.
Okay.
I think that people with anxiety try to do that, but I don't know how effective it is. What ends up happening is that individuals that avoid situations that lead to stress find themselves increasingly living in that bubble. But what also ends up happening is it makes the problem worse. It's reinforcing that thinking pattern that, well, if I just don't do it, it'll be okay. Whereas they're not learning that, you know what, it usually is okay even if you do it. So it leads to more and more restricted functioning. And when it comes to treatment, one of the ways that you do treat people with anxiety is having them start going into situations that lead them to feel stress gradually, small steps at a time, so they can learn that, you know what, it can be okay, they can handle it, and then they can start doing more and more things and get back to living their life.
So would this be considered a part of cognitive behavioral therapy, or is that something else?
Yes, it is.
Okay.
So
Tell me more about that.
Yeah. So cognitive behavioral therapy is actually found to be one of the most effective forms of treatment therapies when it comes to anxiety disorders as a whole. What it is looking at the way people think. So often people with anxiety have negative beliefs about things, and that impacts the way they behave, leading to problematic behaviors. So what CBT, or cognitive behavioral therapy, tries to do is provide them with strategies and techniques to challenge those thoughts, to make them more balanced, and to have more balanced behaviors as a result as well.
So can you give me an example of how that would play out for an individual?
Sure. So for example, if someone has a lot of anxiety about or worries about crowds, let's say, so they try to limit it to maybe only having 1 or 2 people around them at a time. So you would start at a step where it would lead to some anxiety, but they'd be able to handle it. So it might be, you know, are you okay going to a friend's house with maybe 5 or 6 people there, that all of who you know? That would probably lead them to have some anxiety, but maybe enough that they could handle it. So then they would go do that and stay in that situation until they start feeling the anxiety is coming down. And it's not just a one-off. You would do that a few times to make sure that you really are getting comfortable. And then once you feel like, you know what, I can handle that, I can go out with my friends, 5 or 6 of them, you then increase to another, a bit more difficult of a step. So you can see gradually in a step-by-step fashion, you get to more progressively difficult things for that person. And it's very specific to what they are worrying about.
What about thoughts? How would you work on overturning an individual's anxious thoughts?
See, that often I feel like the behavioral part is often a little bit easier.
Really?
So the exposure, because it really is often saying to people, you know, do this repeatedly and it'll work. You almost don't need to explain to them why. Where when it comes to thinking, those are patterns that have been ingrained for many of us.
Someone might think like, I'm a failure, or, you know, I can't do this.
So that's something that takes a bit more time, because that's been there for years and years, right? So that work takes a bit more time, and it's repeatedly done. So it is looking at systematically challenging their negative thoughts and beliefs. So if it is, I am a failure, it is looking at that and not just looking at the evidence for that belief, which is what most of us do. We look for things that confirm what we believe. We don't look at alternative evidence against it. So it's starting to change the way we think and giving ourselves really the benefit of the doubt. And we're so good at doing it for others, but we're not really good at doing that for ourselves. And it's not just teaching the skill, because, you know, I could do that right now with you in a few minutes, but it is, okay, and now apply that skill repeatedly in a way. And CBT often involves a lot of homework, is what I'll call it. So doing work, written pages or typing things out. So it's not just, okay, yeah, no, I'm doing it in my head, because we're often not good at that. We need to write it down and actually have it start staying in our mind and start seeing shifts in that, the way we think.
Do you think cognitive behavioral therapy is a good, you know, alternative to taking medication?
I think for many people, they can have CBT alone. There are many that medication alone is okay. And there are many that also need both, right? So I definitely am someone who thinks that you should be open to what is needed for you at that time. So I know a lot of people are reluctant to either start medication or start therapy. I always tell my clients that, you know what, do your due diligence and get all the information you can from reliable sources. Talk to your doctor, talk to your mental health provider, and get the information and make an informed decision. So don't just, you know, Google it or, you know, speak to someone who's never had therapy or medication, because it's important to weigh the pros and the cons and do what's best for you.
You know, let's say somebody suspects that he or she has anxiety. You know, at what point would you tell them, yes, it's important to go out and seek treatment? And what sort of treatment would you tell that person to look for? What does the person do? I mean, you're feeling anxious, what do you do? You know?
So I always say, listen, anxiety is completely normal. Anxiety has a purpose, right? So if we didn't have anxiety, we would not be as accomplished. We would do riskier and more behaviors that probably wouldn't keep us very safe if we didn't have anxiety. Because I do see a lot of people who are like, I don't want any anxiety. I'm like, well, anxiety has a point. But you do need to be able to differentiate what normal anxiety is and what extreme anxiety is. So I think to me that line really is around, is it impacting the way you live your life? Right? So is it getting in the way of you working, going out with family and friends, doing what you want to do? If it is, I think it's time to get help. Also, if it's leading to other issues. So a lot of times anxiety can lead people to feel depressed or have substance use problems. I would again say you should get help. If at any point you have thoughts of ending your life, self-harm thoughts, you should immediately get help because that is a concern.
How can I, let's say I know somebody who has anxiety, how would I be able to help that person?
So I think, number one, anxiety looks different with different people. So I think I think it's great that you'd like to help them. I think I would start by asking them, hey, what can I do for you? Can I assist you in some way? Because often people with anxiety, their thoughts are they're dismissed. So it is actually just really important just to listen to them and be there for them. I think this is one of the reasons why I think that Nasiha's text and phone line is a great option, because it does provide people that option to hear someone listening to them without judging them. But I also think it's important that we try to educate ourselves more and more on anxiety. And I think this segment is a great place to start.
And I guess not saying the wrong thing. You know?
Yes.
Sometimes we end up saying things that actually harm an individual
Exactly,
hearing
like
them,
saying
right?
it's okay, it's not a big deal.
Yeah.
Actually,
Or you'll
isn't
get
helpful.
over it
You'll
or
get
something
over
like
it,
that,
not
yeah.
helpful. So I do actually think if you're really not sure, I would err on the side of just listening, right? And even suggesting, you know what, maybe you should, reach out to someone to get more help. Right?
What about if you're a parent and you see your child exhibiting some behaviors that look like, he or she might be anxious?
So I think that is something that is quite common, right? So I would start off by saying that you need to talk to your child. And more than just talk, you need to listen to what your child is saying. And make sure that they know that they're loved, that you're patient with them, and again, that you get them help if they need help. I think it's also important that we teach our children some skills that can help them manage anxiety. So skills could be learning to take breaks, exercise, learning mindfulness skills. One really big thing I think is great for parents to do is actually model healthy behaviors in response to anxiety. So not just, your kids never know that you have anxiety. You should actually discuss it. So for me, I have anxiety around calling people I don't know on the phone. My children know this, so I will talk them through what are some of my thoughts around this, but I don't leave it there. I tell them how I push myself to do this despite that, how I challenge my thoughts, and how I do go through and call these individuals I don't know, and that, you know what, it wasn't that bad. So it isn't just, mom and dad never have anxiety. No, it is very normal, but there's ways to get through it and still function.
Huma, thank you so much. There's so much more we could cover, but we have to end it there. Thank you for your time.
Thank you.